Good morning, all of you. Uh, our dignitaries for the day, guests of honor, teachers, seniors, colleagues, friends. So, thank you everyone for joining for the inauguration for this center, MOC Mahim. First of all, I would like to thank Dr. Banawale sir and Dr. Tak sir for coming and giving their blessings. And I would invite both of them for the lamp lighting first, and then we move ahead with the function. So once again, thank you all of you for to join on this Sunday. And today is a momentous day as we gather here for the inauguration of this center at a place which holds a sweet place and heartfelt memories of this place for many of us in the neighborhood. This is a place which is an integral part of the fabric of this community and the society in the neighborhood area. Many of us in the gathering today or their relatives or their family members might have taken their first breath here. So this gives an opportunity to look back into the past, connect with the past and take blessings and learn from the good work which has been done in this and to continue the same efforts in a different way and to serve the society. So MOC, this is the, I lost the count, but it is the 17th center and a group of 24 oncologists and a 7th center in Bombay. So it's not just a chain of daycare centers, but it is a human chain consisting of oncologists, nursing staff, housekeeping staff, pharmacists, laboratory people, physiotherapists, occupational therapists, geriatricians, genetic counselors, to provide not just chemotherapy but to provide a helping hand and a leading shoulder for all the patients and provide all the comfort, care, compassion and empathy, and to make them feel reassured that they are not alone in the fight of cancer. So I am deeply humbled and privileged to lead this center, and I am thankful to God, parents, family, MOC, and also my teacher and mentor who is here, Dr. Banawale sir. And I wish to take blessings of both the dignitaries, both legends in their own fields, as we strive to reach the community and serve the community in the best possible way. Dr. Banawale sir was my teacher and mentor at Tata Memorial Hospital, and I am deeply blessed and to have him as a dignitary here. And what I am currently is through blessings of Banavali sir and all the teachers at Tata Memorial. So I would thank sir for his teachings. And whenever I have walked into his office, he has always given me two words or two sentences of wisdom, and I always come out little wiser or little probably more empathetic and compassionate. So thank you, sir. Now I would ask the dignitaries for the curtain unveiling. So I would introduce you to both our guests of honor today. Dr. Banavali sir is a director academics at TMH and also a professor in medical and pediatric oncology. And he has worked so much to make sure that the cancer care reaches up to the most rural part of the Maharashtra, and he has done a lot of work in Derwan. And he is almost a father of metronomic therapy in India, and that has changed lives of so many and millions of people of cancer patients in India. Thank you, Banavali sir. Dr. Jaydeep Tak sir, he is a legend. He is a consultant gynecologist and IVF specialist at Ashwini Maternity and Surgical Hospital, and he has been doing 3 to 4,000 IVFs every year, and he is the president-elect of the Foxy Society for the next year, and he has been president for Mumbai on Obstetrician and Gynecological Society, and also he has held several posts simultaneously at one point of time for the Mumbai Society, for the Foxy, and also for the FIGO. So we are pleased and blessed to have him here, sir. Now I would invite the chief guest to say a few words and give us blessings.
Putting us into this thing. Come. So first of all, congratulations Kunal and the whole MOC team for your 17th center now. And I was talking to them, actually, the very fact that you are now in the 17th center and increasing shows that there's a big need of such centers in the country. And definitely, actually, when we practice, some of my training was in US, and there everyone used to practice, group practice, there's no solo practice there. And then when we came back, we thought, why this is not there in the country? And first Chirag in Ahmedabad, they started the group practice, and now MOC has taken over and this thing. So I think India also it's changing. So, very fact that we are having so many centers, because institutions can give this thing, but there's something which the personal touch, the personal connect, the empathy, maybe when you are in a big institution, that somewhere it loses. Whereas that one-to-one touch, the empathy, the compassion, maybe it is more, you can give more when you are practicing in small groups rather than a big institution. And I think that gap which was there is being fulfilled by centers like MOC, and I think it's going to increase further, and this its need is going to be there. But like I always tell, Kunal knows that I always tell not only him, but all my this thing is you have to look at the patient. All that practice we are taught a lot, but if you practice as per what is there in the theory, it doesn't reflect when you practice in the clinic, and you have to keep the patient first, the family first, and then only take the decision rather than decisions on your knowledge, because there's more to medicine than theory, and that compassion, that empathy, that also is medical humanities now. It's not a compulsory subject. The NMC has made medical humanities, now they called health humanities, as part of the curriculum. It's still not there in the country, but I think that's slowly coming up, because we have to teach them. Half of it is medicine, but the other half is human beings also are as important as your theory. So I think please keep that in mind, and this all the best to this center, and all the best to MOC and many more centers in this thing, and fulfill the need which is there in the society. Congratulations once again.
Thank you so much, sir.
Uh, Thank you very much for inviting me, Kunal, Ashish, Vashisht, and the entire MOC team. I have actually known Vashisht since many, many years. And of course, I have known Pankaj Bhai and Rakshabin since many more years than that. And it is a privilege and a pleasure to be here. Yes. So, that's a lot of years. I think my first exposure to cancer as a professional was when I was doing my internship in New York. My first posting in gynecology in New York was in gynae oncology, and the first day when I joined that posting, I walked into there was a tumor board meeting, and I walked into the tumor board meeting, and they were cutting a cake for a 17-year-old girl who had ovarian cancer and had survived for 2 months more than what they were expecting. Obviously, this was a long time back, and that sort of shaped my perception towards the care we give to our patients of cancer, where every victory, however small it may be, is a important and considerable victory. I know that things have changed considerably since then. I was speaking to Vashish the other day for one of our relatives who was undergoing chemo, and I was quite pleasantly surprised to know that chemotherapy is not the horror that it used to be once upon a time. It has now become a daycare thing, it's become a routine thing, and it has now become something which patients tolerate very well. And I think this perception of chemotherapy being this night pill, where there are so many side effects, it's not tolerated very well, is something which needs to be driven as a narrative. And I think MOC is perfectly placed to drive this narrative as chemotherapy being not a nightmare and a dangerous and a very terrible thing that it used to be perceived. Since I'm the president-elect of FOXY, I should say that we are going to concentrate a lot on gynae cancer next year. We have a project with the American Cancer Society, which we are going to roll out, particularly in the northeast of the country, because there is a felt need there. But I think there is a felt need for cancer treatment all over the country. And I'm delighted that MOC is going to open many more new centers, and I think you're filling a very important gap in this felt need of cancer therapy. So congrats. I understand you're looking for dates to open your next centers. Let me tell you, I'm available in case you invite me again. And thank you very much. Congratulations, Kunal. All the very best, and here's looking to many, many more centers from MOC, and the best and most accessible treatment for everybody who needs treatment for cancer care. Thank you very much.
Thank you, sir, for your valuable insights. Now I would invite Dr. Udip Maheshwari to share a few words on vision of MOC and what it stands for.
Hello. Hello. Hi, good morning everyone, and I welcome all of you to this new center. It's been a habit now, so we call this Hello. Yeah. So we call this an epidemic of MOC. It's happening. The season comes. There are 3-4 months where we have constantly all my kids and kids tell me आज opening जाना है sir. Next week भी sir opening है. तो पापा को ऐसे ही पूछते. So I am very happy to present that we started MOC with a few, and now every day morning we think what's new, right? So so it was a vision, it was a dream, and rather it's now become an ideology. We want to create this ideology and transmit this ideology. A very unorganized sector of oncology is something that we are looking to organize, and we hope that this map surely and soon it should come to the India map, right? So we'll have an India map soon in next 2-3 openings, and I again welcome you all, and hand over the mic to the organizers. Thank you for coming. Thank you.
Thank you for the insights. And one thing I wanted to share is before coming to, before even thinking of taking up oncology, I think I first met Ashish Bhai and had visited the Borivali Center, and he had guided me about what oncology is all about. And so thank you Ashish Bhai, thank you Ashish Bhai, thank you Pritam sir. Now I would ask Dr. Vashish Mania sir to felicitate our chief guest for the today. I would ask Dr. Pradeep Kendre sir to felicitate and welcome Dr. Jaideep Nag sir. Now we would now in a minute we would move on to unveiling the center and ribbon cutting. Thank you, everyone. Now, I would like to invite all of you to take a tour of the center and also join us for the lunch, which is behind. Please. Thank you so much for coming in and joining us.